Good evening, everyone. I just want to thank you for joining us for the Healthcare Operations Pitch Club tonight. We're excited about this because definitely anyone that works in the medical field is affected by healthcare operations. And so we're excited about the solutions we have to present. We also have 3 companies that will be presenting in our Pitch Club extension, and we'll provide those videos to you in a follow-up email. For those of you that are new to Pitch Club and not as familiar with AngelMD, AngelMD is basically a network of primarily clinicians and startups, as well as investors and people from industry sorry, I hear an echo, that really the idea is to bring together, experts from these different areas to be able to really help startups in healthcare innovation to be successful, not only in getting to market, but continuing to grow in market. And it's important to us to hear the voice of the physician. And so that's actually why we started Pitch Club. So Pitch Club is really targeted more at our clinician network. And obviously we're happy to have everyone come and join, but it does get a little more into the technical aspects of the product and a little less presenting from kind of an investment business presentation. But it's a great opportunity to really learn and understand more about the solutions that these companies have created. So tonight we have 2 great companies, Nirman Healthcare Technologies and Medecipher Solutions that will be presenting. And then when we are done with those, we will actually have time for a breakout session. And we should be able to get all of this, both networking and the presentations, done within an hour, because we do want to respect your time. So with that, I am going to turn it over to our MC, Dr. Katie Richardson.
Great, Jennifer. Thank you so much. We, again, are really excited to be here. We have 2 great companies to pitch, and we're going to have a lot of fun tonight. I think you guys are going to really enjoy this and learn a lot about some cool new tools that certainly can help with the healthcare operations side of things. So our first presenter is Chandu Revenur, and he is the CEO of Nirman Healthcare Technologies. Welcome, Chandu. We look forward to hearing your pitch. You can go ahead and share your slides.
Well, thank you, Katie and Jennifer. I appreciate the opportunity. Let me share my screen. Okay, well, Chandu Revenur, representing Nirman Healthcare Technologies. We're a company with a vision to provide better patient outcomes, increased revenues, and reduced cost of care. What is the problem that we're trying to solve? Many medical providers, particularly individual practices, suffer from several of these issues. Opportunities for preventative care are missed. Predictive care management is lacking. Visibility of high-quality prescriptive data can result in poor health outcomes. And then the overall claim and billing process is highly inefficient or sometimes not sufficient. And how do we address these problems? Currently, the data is residing in several different sources. It's very abstract. Processes are not streamlined to improve the outcomes of patients. So what we need to be able to do is to monitor and track that patient data. This will provide data that is digestible, better analyzed, and actionable. With this, we can lead to better chronic condition management and solve the issues around predictive care. Further, then we can analyze the data better and link it to different EHR, EMRs, and payment platforms, and link it all together, bring it back into the system intelligently, and increase the incentives that state and payers are providing to providers, to medical providers, and thereby better improved reimbursement rates. This comes to the next part of the solution, which is automating the claims process, improve metrics, and then reduction of rejection and denial rates, and simplified back office administration. Let me briefly describe how we measure the pulse of a medical practice. What we do is when we talk about patient monitoring, exactly how do we do that? We provide integrated real-time operational and quality dashboards with proactive alerts. And this is an example of a patient quality report from our suite of portfolio reports. Our solution is able to draw data from multiple sources like EHRs, the Health Information Exchange, state portals, payers, field data, and we aggregate it by practice. We can go down to the location. We can provide information based on a specific provider, or in fact, drill it down to the patient level. This level of details provide visibility to the care gaps that need to be closed, and we compare those metrics for each of the gaps with the HEDIS measures, comparing the targets versus the actuals. This level of visibility provides effectiveness of care for the providers. Automation and streamlining of this process at the patient level enables better chart prep times. We also have algorithms that maintain and manage the no-show probability index. This is for all scheduled patients to increase efficiency in the process, thereby increasing the overall provider's utilization. Now, this helps with the next step of the process, which is managing the chronic patients management. It makes it a lot more transparent. Now, here's a dashboard for a patient, chronic conditions, and patients with multiple chronic conditions. Filling these care gaps provides information for a provider or a practice with timely intervention, specifically to pay special focus on high-risk profile patients. In fact, there's prescriptive outreach that the administrative staff can also reach out to these high chronic condition patients. Our solution also provides risk stratification. So we're able to categorize and identify patients into low, medium, and high risk categories and predict movements of these patients, from one level to the other. This is very dynamic in nature. We collect real-time data from hospitalizations, the EDIP visits, morbidities, and then there's severities. The plan to be able to stay ahead of risky outcomes and to pre-plan this better manages the health of chronic patients. With this continues the journey to the next level with predictive care profiles, we can arrive to better health outcomes by staying on top of patients' continuous care. Tiered targets defined by state or payers are defined, gaps between actual and targets are measured, and we also prescribe how to close some of these gaps, depending on different care gaps. We can also not just meet, but help providers exceed quality metrics, and then that allows the practice to attract better or improved incentives from a state, program, or a payer. By doing such prescriptive care, it makes all of us stay ahead of a problem, preventing them from getting into a crisis. So these preventative care solutions allow payers also to be a lot more amenable to better improved reimbursement rates and thereby lowering the cost of care in general. So better outcomes, improve revenues, lower cost of care. This comes a full circle into the simplified administration for the back office for claims management. Our processes improve the efficiency with proactive alerts, such as incomplete progress reports, aging of the claims, a submission lag, and overall reducing the denial rate by giving better visibility. We stay ahead of the combination of the ICD and the CPT codes that receive highest rejection rates, so we can pre-plan and guide physicians through the prescribed outcomes for favorable acceptance of claims. How do we do it? What's our process? We take information from multiple different sources, such as the Information Exchange, EHR, pharmacy. These are all abstract, unstructured in nature. We pull the data together into a data pool. We call it the data lake. We use artificial intelligence and machine learning technology in order to then structure the data into a warehouse, providing intuitive, actionable, user-friendly experience reports that can be acted upon. These are some examples of the companies that we've already built connectors with in the industry. In fact, earlier this year, we did a study with Copa Health in Arizona. We tracked several of the reports that were manual in nature, and after we deployed our solution, we saw significant improvements, somewhere in the range of 80 to 90%. On an average, we've seen 40 to 50% improvements of productivity One such example is this health questionnaire report that was running about 5 hours every 2 weeks that brought it down to about 15 minutes. In fact, the CIO, endorsed us by saying that we are a crucial part of their digital transformation strategy, and then they would actually refer us to other people anytime. Closing out with our timeline and the team, we started last year, the launch of the company, starting the first pediatric practice, went into an adult practice with advanced analytics and machine learning earlier this year. And we're going to close this year with about 5 practices, about 125,000 members. We have expanded our advisory board, and we're looking at aggressive growth opportunities next year in terms of this forum, looking at future advisory board members. We're also looking for funding to fuel our growth with sales and product management. Overall, we've got a great team behind us, and I'm going to leave you with my contact information. I thank AngelMD for the opportunity and open for any questions.
Chandu, fantastic. Thank you so much for telling us about your solution. One of the things that I think are in healthcare with digital records and movement all to EHRs, we have so much data, I think, that it's very difficult even to manage or get it into a usable form. So I love the fact that your solution can really take these, I would say, disparate data sources, pull them together in an integrated data set, and really help folks, not only manage the data, make sense of it, but put it in something usable. So that's fantastic. I'm going to start with one of my questions, and then I know we have some in the Q&A as well. So again, if you're in the audience, please put your questions for Chandu and Nirman Healthcare Technologies in the Q&A. So you mentioned risk stratification of patients. Can you talk more about that and how you believe that your platform can lead to better patient outcomes?
Sure, Katie. Well, it's a great question. In fact, that is one of our sweet spots. We realized that focus on chronic patients and patients with high level of risk profile is probably the most important call to avoid future costs of care. In order to do this, what we do is we go through the roster of all the patients, and we're able to dynamically link them into low, medium, or high risks. And we follow this pattern through hospital visits, emergency room or inpatient visits. And this is a dynamic algorithm that runs. So you can have a medium risk patient jump into a high category. And these are the patients that we provide the list to practices and providers in order to better follow up with them and make sure that they do not end up into a much worse scenario. So prevention and journey from sickness to wellness is what this looks after.
Great. And as I mentioned before, the fact that you have this integrated data set, I am guessing that there are probably other tools that could be developed to really further improve efficiency. Is that true? Can you talk about some of those?
Sure. In fact, as we rolled out our initial solutions across the journey from pediatrics to adult to mental health practices, we've received requests from the practice providers on some on-demand requests, such as, for example, one of the clinics in Phoenix, Arizona, they came to us and asked us about reports related to sending out an SMS for example, COVID shots across. So we use Twilio as a platform in order to then broadcast this information. And we've also done birthday reports as another. Our solution is very scalable. The bot framework and the handshake protocols that we use are very scalable in terms of we can work with different systems, and once the connector is established, then we can really leverage that to add on more solutions.
Fantastic. So we have several physicians in our audience that have great questions for you. So I'll start with a few of those.
Okay.
from our one of our physicians that's close to a world away, I feel like at this time, and up in the middle of the night watching, how willing are different healthcare providers to share patient data? So for instance, chronic diseases and specialists, would they lose those clients if they share data with their, say, primary care colleagues? He notes that I face this issue while trying to implement a program for kind of self pre-anesthesia questionnaires, automatic assessments. So how would you answer that question?
Yeah, if I understood well, then it is our exchange of information, of patient information between providers, right? Or is it between providers and us as a service company?
Yes.
Okay. The entire data resides in the United States, so it is very secure. Our data in our platform is actually completely masked, so we do not have access to the data unless you have the provider's credentials. I don't see a particular risk of, I understood the question to be as loss of patients is what I understood, Katie. Is that correct?
Yeah. So the question really is, are they, if say I'm the primary care provider and I have all this rich data now that I'm getting from a variety of different sources, am I going to be able to manage these patients better? And potentially I wouldn't have to refer some of them. So I think it's the idea that, could it generate lost revenue for some other, say, specialty practices, et cetera, because the primary care practice is able to manage so much more?
Well, we don't see that today. For example, what we are able to do is actually give visibility of those data with pre-alerts, with actionable insights, so each practice can make better decisions for their patient population, thereby improving the outcome of the population. We don't see today, at least as far as about risks of sharing information across different areas of loss of patients. I can certainly go back and check. We have not come across this type of a situation yet.
I bet you're right. I mean, I would say from the integrated healthcare system that I worked in, with the healthcare information exchange at this point, there is so much sharing of data from hospitals to clinics to specialists, et cetera, that I don't think it's that big of a deal. I'm with you. All right, a couple more questions. Dr. Eisenberg says, I think this is a great platform. Which types of practices are you targeting? Seems like many larger systems may have a competing or similar product already. So maybe answer that question, talk a little bit about your competition too.
Sure, yeah. Originally, when we founded the company, we were looking at large hospitals. Our journey to large hospitals, actually, you're right, they had their own IT department. They were a little bit hesitant to work with a smaller startup. So that's when we went back up the food chain and we started with a pediatric practice, Happy Kids. Here are some logos of the companies that we serve. Then we went to a mental health practice, and then adult practices, which is Feliz Care Partners. And now we've just expanded into eye physicians, and just recently we rolled out to another pediatric practice. So between childcare, adult care, and mental behavioral care, I think we've got the spectrum covered. Your other question was about large scale. I think we look to increase our footprint into hospitals and eventually get into the payer space, where we do expect to work with large payers that have a network of providers in their system that potentially could actually endorse our product once they are familiar with it. In terms of competition, Katie, Lightbeam is a company that comes to mind. They've been around. I would say that they have similar offerings, yet our secret sauce of flexibility of RPAs, which is the way we extract, transform the data, and real-time presentation of the information, is, I think, what cuts us apart from any competition that we have seen so far. we're also highly scalable, and this gives us somehow an on-demand suite of reports that we can work with our customers.
That's great. There are a few more questions that I know for those of you that are willing to stay for our networking time. Chandu and his team are going to be very much willing to answer them. Thank you again for being here tonight and for telling us all about your company. Again, I think this is a really cool way, just knowing, coming from a large health system myself, knowing what we went through to try and bring some of this data together. You guys have a solution for folks that don't have the ability to do that, which is awesome.
Excellent. Well, thank you, Katie, and I thank AngelMD and the whole team for this opportunity from Nirman. Bye-bye.
Absolutely. Stephanie Gravner is the CEO of Medecipher, and she's going to tell us all about their solution today. There we go.
Okay. How about now? Great.
You're
Hi,
great.
everyone. I'm Stephanie Gravener. I am CEO and co-founder of Medecipher. Thank you so much for the invitation. Happy to be here and talk to you about our solution for transforming nurse scheduling and management. Nurses have played such a critical role in the pandemic, but they're burned out and leaving the profession in droves. 1 in 5 nurses has left their job since the start of the pandemic. Nurses are overworked. They're deeply worried they can't adequately care for the large number of patients they're responsible for in each shift. And furthermore, a recent Wall Street Journal cited hours and poor pay as 2 of the top contributing factors, forcing many of them to quit. Current methods for care team planning and scheduling, they're really contributing to nursing turnover. They're propagating unsafe staffing practices, leading to poor clinical outcomes, increasing risk for clinicians, increasing scheduling churn and insecurity with last-minute changes or attempts to call nurses in. And then finally, leading to needs and preferences not being met. Requests for time off or for a certain day are simply being disregarded. So Medecipher is here to really disrupt the status quo nurse scheduling methods. And let me show you how it works. We're going to look at an application in an acute care setting. I'm going to show you the busy emergency department with a nurse manager, Jessica. So Jessica would log in. She would view the alert that today she's going to be overstaffed based on the predicted census and patient load by about 61 hours of nursing care. She would quickly scan the operations metrics, the predicted census, and notice that she's going to have mostly new nurses on staff today. This would make her hesitant about flexing all 61 nurses of nursing care, so she would use her clinical judgment, select a conservative case, make any adjustments as needed. With Medecipher, she has immediate insight into the performance impact of these changes on her metrics, like the productivity metrics shown here, which are now on track thanks to the changes that she has made in the tool. So now that we've seen the platform in action, if you will, I want to pull back the hospital exam room curtain to take a peek under the hood at the science that is powering Medecipher's workforce optimization platform. Our platform really comprises 3 distinct components: predict, prescribe, and adapt, that build off of each other, and a feedback loop that connects the 3. So first is a very robust forecasting model that is predicting the patient load. For example, the emergency department census is shown here, plus our recommended nurses per hour for that particular day. Then is a patient flow simulation model. And what this is doing is it's anticipating the performance impact of those key operational metrics, efficiency metrics, safety metrics of decisions regarding nurse staffing specifically. The forecasting engine feeds our multi-objective mathematical optimization model. This model is balancing overstaffing with understaffing, helping to reconcile cost against quality. The engine is using predetermined rules and constraints such as shift times, position control, union considerations, and adhering to all of those constraints to figure out the best combination of shifts to achieve optimal results and the best combination of nurses and human individual people to staff those shifts. The model is gently guiding the user to implement these changes. For example, adding a shift here, canceling hours at the start or the end of the shift. And then, of course, it's up to the nurse manager to use their own clinical judgment to make any adjustments. Once the changes are committed, the machine learning platform learns from those modifications that the nurse manager implemented, and that feedback is reincorporated to improve future predictions. We've proven that our solution impacts cost, quality, and most importantly, nurse satisfaction. When Medecipher was implemented at Northwestern, we saw a $300,000 reduction in overstaffing costs. These cost savings were realized by reducing overstaffing, so having too many nurses than were needed at a given time, and also reducing use of premium pay, which is agency use or use of incentive payment, such as overtime, to incentivize nurses to fill an unscheduled, or to incentivize nurses to sign up to fill an unfilled shift. We also saw that we improved their operations, enabling Northwestern Medicine to recapture unmet demand, reducing the walkout rate by 40%. So this represents patients who otherwise would have left the department without being seen, also impacting ambulance diversion, resulting in a higher admission rate and margin, driving $1.2 million in additional revenue to their system. And finally, impacting nursing satisfaction. We've reduced same-day use of cancellation, so reducing the churn in the schedule, also enabling them to justify additional nurses per shift, which is increasing the instances of safe staffing and the satisfaction coming to work every day with that confidence that you have the right number of resources and colleagues to help you out. So in total, about 1.5 in value creation and happier, more satisfied nurses. What more really could you ask for in a solution? We've rapidly grown since launching our EHR integrated MVP at Northwestern Medicine with a beta at Wellstar and a pilot proposal to test a new use case and to offer end-to-end decision support with Queens Medical Center. We're hoping to expand by 3 to 5 sites per year. We're also expanding beyond our footholds in the emergency department market to expand use cases spanning across the entire acute care setting, from inpatient nursing, eventually outpatient nursing use cases. We've done all of this very capital efficiently, using mostly non-dilutive funding from grants, such as a recent $1 million NSF Phase 2 SBIR, and are hoping, fingers crossed, to receive funding from the American Nursing Foundation. Finally, we intend to launch an initial seed round in the spring of 2022. We have done this with the help of all of our amazing acceleration partners who have invested their time and energy in helping to vet the solution and give us opportunities to speak with physicians such as your group over here. We've won awards from the American College of Emergency Physicians and published the results of our work in really the top peer-reviewed journals, including JAMA and the Joint Commission Journal on Quality and Patient Safety. Looking into the future, we're intending to partner with some strategic partners, strategic technology partners, to really unlock additional customer channels and to reduce some of our technical debt by improving our software integrations. Our traction and success is really thanks to our team of industry veterans and thought leaders with unmatched domain expertise and extensive industry experience in best-in-class health systems. Myself, I have a background as a health system engineer focusing on operations research and patient flow. But we've got amazing team members and mentors. Brian Rosenfeld, who commercialized one of the first EIC monitoring platforms with a successful exit to Philips. Darren Dunbar, who is an esteemed nurse leader who's worked at places such as Johns Hopkins, have really helped us engage with the community and expand the product to multiple applications. So thank you so much again for your time, and look forward to turning it back over to Katie for any questions.
Great. Thank you, Stephanie. This platform, I think, is really exciting as well. One of the things that we heard loud and clear in our recent Impact Summit is the fact that I would say lots of healthcare providers, unfortunately, are leaving healthcare, but nursing turnover and nurses leaving the field, as well as, what can we do to retain these great nurses? It's one of the, I think, biggest challenges for health systems right now. And clearly COVID put a large strain on that as well. So this is exciting. I'm excited to hear more about this future study that you talked about, looking at impact on nurse turnover. Can you talk more about that?
Yeah, thank you. So let me pull up. So we are, so we're proposing a new case study with Queens to really look at turnover, specifically to understand whether or not more satisfaction around the scheduling processes leads to improved retention. So what we're focusing on is increasing, really kind of changing the application from just flexing to really study the planning and the assignment modules. So working on having an improved schedule up front, seeing how that can really benefit downstream. One of the things that we're really excited to be able to measure is turnover, retention, engagement. So hoping that we can partner with additional technology vendors. One is called Laudio, that is an EHR integrated satisfaction tool that helps sort of in real time capture engagement, burnout, fatigue, et cetera, such that we don't have to wait for really sort of latent indicators such as an engagement survey or turnover stat that really only come up sort of once a year, so that we can really get ahead of this and see sort of in real time in a short pilot proposal what the impact on retention, engagement, turnover, and satisfaction are.
Great. I think that'll be really exciting to see for sure. You also mentioned, I think in your timeline, you just had it up there. I'm like, I want to know more about this end-to-end decision support that you're talking about implementing. Talk more about that aspect.
Yeah, I think there's really a true lack of integrated decision support for the entire scheduling horizon. From when budgets are created, that's really a year in advance. There's companies such as, Vizient, Truven Analytics that provide some benchmarking, but it's essentially what everybody else is doing. So you might say, we want to be top decile in terms of our performance. Let's look at who's in the top decile for our peer group in Vizient, and we'll benchmark against that. But that doesn't really help you think about how to do this sort of better and more intuitively. Again, when the medium-term horizon is being considered, these are routine. Every month, you're creating a schedule, you're creating the assignments, and there's, again, a lack of decision support for those routine activities. Most institutions for nurse staffing are using some combination of Excel or Google Sheets to create the scheduling grid. And then they're gathering requests from the legacy ERP system, whether it's a Kronos or an API, or it's emails, pencil and paper, and reconciling those preferences and requests. And then a nurse manager is really doing this manually by hand, mapping people into a particular slot. And so you can understand how this is super frustrating. And a lot of times a human is sort of not able to meet the needs of all of the staff that put in the requests. And then finally, when it comes to short-term decision support, we see, there's dashboards available in Epic and Cerner that provide perhaps like what's going to happen in the next 4 hours in terms of the census or expected volume increases, but it doesn't really tell you what to do with that information in the context of changing your staffing decisions. So what we're really aiming to do is provide this this end-to-end decision support that spans when the budgets are created to when the schedules are created to when the schedules are adjusted, and be that one-stop shop for nurse managers to use our platform to really inform and support the entire decision horizon.
That's fantastic. I want to move on to a few questions from our audience here. One of our audience members, love what you've done, and I believe that nurse scheduling is a real issue. However, isn't there already burnout due to the burden placed on staff to log into not only the EHR, but as you mentioned, they're usually going into Kronos and several other systems. Does this add, have you found with your current partners that is a barrier, that they have to log into yet another system, use another tool?
So simple answer, this is a tool for the nurse manager or the nurse scheduler. So it's really only perhaps 3 or 4 people tops in a single department using this tool. The tool is not meant to be a tool that the bedside end user uses necessarily. So we're really limiting it to the people who are currently doing the schedule, currently spending 20 hours every month on this. And we're essentially disrupting their Google Sheets and handwritten sort of note workflow.
All right, and I think I can actually answer this question. But yes, current state is only in the emergency department for staffing, correct? And you're looking at moving into some of those other areas.
Yeah, and that's the proposal that we've submitted with the American Nursing Foundation, is really to sort of expand the use cases following the patient flow pathway through the hospital to inpatient med surge. So essentially we're asking for funding to transform the emergency department footholds use case to those expanded application areas.
And lastly, and I think you mentioned this maybe as Paul was submitting this question, I think you may have answered it, but how are you quantifying burnout? What are the exact points that nurses would say this needs to be improved in order to not leave, right?
Yeah.
In order to retain, and how are you quantifying those things?
Yeah. So here, actually, so there, I don't know if this is on this slide. Maybe it's not. So for example, the employee engagement survey typically has a question around, do I have the necessary resources to do my job? So there are specific questions for each organization pertaining to the scheduling process. Laudio, which is a technology partner with us, they have their own metric that's proprietary to them that measures burnout. We're not trying to reinvent the wheel by creating a new metric. We want to partner with them to be able to use their existing metric and get those results.
Fantastic. Well, Stephanie, thank you again for being here with us tonight. It's very exciting to hear about this platform, and I'm sure we're going to hear much more from you in the future. So that is very exciting. Thanks also, I want to say, to all of our Pitch Club extension videos. We actually have 3 companies who you will see those videos. They're going to be sent out in our post-event communication. So don't hesitate to take a look at them. But I know that several of those folks are also here and look forward to networking with you here in a couple minutes. I want to just say thank you to everyone for joining us this evening for this Pitch Club.